going to go ahead and get started. I do want to let you all know that this webinar is being recorded and will be available to you all very soon. I will be uploading it into the website. If you can please confirm, type in the chat if you can hear me. You can type in yes. Awesome, thank you, Juan. All right, good morning, everyone. Thank you all for joining me today for the Housing Specialist Certification Program Decision Makers Overview. As you all know, my name is Erica Alfaro. I am the CEBA Advisor for Housing here at APLA Health, and I will be moderating today's webinar. All right, so before we proceed with the webinar, I do want to take care of a few housekeeping items. For those of you who are new to using Zoom, I wanted to introduce a few features just to encourage for you to use. First, I do recommend that all participants minimize their screen to make sure that you can see the presentation slide. So as you can see here, this is what your screen should look like. If you scroll down to the bottom of the presentation, you will see a ribbon with various widgets. You can turn on the widget for audio. This will give you the call-in information. Some of you, if you've used Zoom before, you can also use your computer audio. Everyone's line should be muted for the duration of this webinar. We also have closed captioning available for this webinar if you'd like to access it. You can scroll down and click on the closed captioning widget. Once it is on, it will turn green. I also do encourage you all to ask questions during the course of this webinar. You will see a chat box if you click on it, or the chat widget if you click on it. When you click on this widget, the chat box should appear on the right-hand side. Please enter any questions that you may have in the chat box and ensure that the message is being sent to everyone. You can also send me messages privately if you prefer. And during the course of the webinar, I will be answering questions, or I may answer the questions till the end of the webinar. And as I mentioned, this webinar will be recorded. Once I work on subtitles and upload it, I will make it available in our Housing Specialist Certification website, and I will send an email to all of you informing you that it's available. First, I would like to acknowledge the Los Angeles Housing and Community Investment Department, who have given us the opportunity to develop and successfully deliver the Housing Specialist Certification Training Program to increase the capacity of housing specialists in LA County to provide housing services. And I'd also like to thank Matthew Mohanan, who has really taken an active role in learning about the Housing Specialist Certification Training Program since joining HCIDLA. And finally, APLA Health for developing and implementing the Housing Specialist Certification Training Program, supportive workshops, and webinars for housing staff. So this is today's agenda. I'll be going over a few things. First, I'll be providing a quick overview of the Housing Specialist Certification Training Program. For some of you, this may be a refresher if you've participated in previous decision maker overviews, but I know that there may be some managers that are newer, and I would like to provide them some background information about the training program. I will also be sharing the results that we've gathered from the certification training, as well as data that we've gathered from the supplemental workshops and webinars that we've been able to provide to housing staff. And finally, I will be sharing the activities that we have planned for the 3-month extension. So the individuals involved in the Housing Specialist Certification Training Program include Jeff Bailey, who is the Director of HIV Access at APLA Health, and myself, Erica Alfaro, the CEBA Advisor for Housing. As many of you know, I shared with you all that APLA Health's capacity building program did not get funded for the CDC contract cycle, for the new contract cycle. And therefore we had to say farewell to our former colleagues. And so I just wanted to share that information with you so that you're aware of who is involved in the training program moving forward. So the Housing Specialist Certification Program was proposed based on the years of experience that APLA has been providing to clients in terms of housing services in LA County. You all know Bill Brown. He is a program manager for housing support services here at APLA, and he's been able to implement a very successful model in terms of providing housing services in a more holistic manner to ensure housing stability for our clients. In addition to that, our capacity building program had been providing capacity building services for actually over 15 years. I should have edited that on the slide. We had successfully developed a capacity building framework, which I will be sharing with you all later on in this webinar. And we've also developed resources to build the capacity of HIV prevention and HIV service providers that are also applicable to the work done by housing specialists. In the area of capacity building, CEBA created, among others, resources that are relevant to the work we have been doing in the certification program. So here are some of the expertise of the CEBA program that have been relevant to the work that we've been able to do for the Housing Specialist Certification Program. So one of them is housing services. We were able to collaborate with other CEBA providers to develop the National HIV Navigation Services Training for the CDC. We have developed a 101 core competencies, which supplements the motivational interviewing techniques training. We have our mental health and substance use screener, which is a great workshop to build the capacity of non-mental health providers to work with and screen clients who may exhibit mental health or substance use challenges to ensure proper referrals are being made. And CEBA also developed the workshop focused on social networks. So as I mentioned, we didn't get funded for the CDC. However, a lot of these resources are still very helpful and can be tailored for housing specialists in LA County. If you see here the core competencies and the mental health and substance use screening workshops, those were actually tailored for housing specialists, and we were able to provide those workshops for them. And I'll be sharing some of the data with you on those two specific workshops. We've found that the Housing Specialist Certification Program is one, if not the first, certification of its kind nationally. We have been able to develop a model to standardize the provision of housing services in terms of laying out a framework and steps from initial contact with a client to reaching housing stability. The certification focuses on the skills and competencies housing specialists will need to engage and retain clients in housing services. These opportunities open the door to not only enhance the skills that housing specialists have, but also enhance the quality of services we provide to the communities that we work with. So some of the benefits of the certification program that I wanted to share with you all is that one, it creates a baseline understanding of the core skills that are needed to provide housing services. Additionally, it helps housing specialists understand their roles and responsibilities. As we know, some of the clients or many of the clients that we work with or housing specialists work with have a myriad of needs. And it's important that housing specialists are able to identify what their limits are in terms of providing services and when it's appropriate for them to refer them to another provider. In the past, housing specialists were tasked with providing a referral to housing and then hoping that the client will remain in housing. But this certification will expand the understanding of the role of the housing specialist in a more holistic role so that we can guarantee consistency in service delivery. So this means that if we have a client who goes to SRO housing, but then they move to Long Beach, then they can receive the same services from Housing Authority of the City of Long Beach. So again, it's forming a standard provision of services. So now that we've talked a little bit about the history, I wanted to shift gears and talk about what is the foundation of our CEBA work. So some of you, if you participated in the Housing Specialist Certification Training, you have seen this model. So we were able to develop this housing services model. And as I mentioned, it's presented in the 3-day training. So it's divided into 4 steps. We have recruitment, initial contact. The second step is engagement in housing services, the provision of housing services, and closing the case. So when it comes to closing the case, that may look a little bit different from agency to agency. And what we talk about with housing specialists is what that may look like. So it's important that housing specialists are kind of aware of what that may look like in their agency. Okay. And then when looking at step 3, as we really emphasize in the training, this is a step where they do the intake and the assessment, is where they begin to identify the barriers the client may have to housing stability. But we are aware that sometimes things change. And so when developing the housing plan, we emphasize to make sure that they capture those changes. And I know I'm kind of going backwards here, but with engagement and services, it's building that rapport with clients. Sometimes the client may not share all the information with the housing specialist in the first meeting. Sometimes it may take the second or the third meeting until they identify some of other barriers that the client may be experiencing when it comes to housing, right? And as we also talk about, it's not always just about housing, because there are so many barriers that the client may have. It could be other things that could inhibit them from being able to keep their housing or obtaining housing, such as maybe employment or maybe not having support. And so we talk about all those barriers that the client may have during the training. So as you all know, there are two phases to the program. When we developed this program, we decided to use the mixed methods approach. So for the first phase, which is the online phase, it is a self-paced pre-course, and the online pre-course has a series of modules and assessments. Housing specialists can gain some of the foundational knowledge before attending the face-to-face training. In order for housing specialists to be invited to phase 2 or the in-person training, they are expected to achieve an 80% or above on the module assessments. So there are 5 modules. So it's expected that each housing specialist achieve 80% in all 5. Housing specialists have 1 week to complete the first phase and are able to retake the module assessments until they receive a satisfactory score. So that means that even if they get an 80%, if they want to score higher, they can take the assessment as many times as they would like. Phase 2 is a 3-day in-person training that's focused on building housing specialist skills and competencies around the provision of housing services. There is a pre and post test administered, and a passing score of 80% is required to successfully complete the housing specialist certification training program. So the 80% is required for the post test, not the pre-test. I just wanted to clarify that. If participants do not achieve an 80% on the post-test, then they will be invited to another face-to-face training. So for this, they won't have to redo phase 1, they would just have to redo phase 2. So I wanted to share with you the flow chart that represents the process of the Housing Specialist Certification Training Program. As we can see, we start with the eligible participants, which are the agencies that are funded by HCIDLA. And sorry, I'm just making sure all the arrows appear. The funded agencies participate in the orientation known as the Housing Specialist Certification Decision Makers Overview webinar, which you are all participating in today. And after the decision makers have participated in the webinar, the registration process begins, which is comprised of a letter of agreement. So some of you have new staff, and I've already begun the letter of agreement process with you all since the webinar is today. And I am starting the registration process for those who have already submitted their letter of agreement. For those of you who have never seen the letter of agreement before, it's signed by both the housing specialist and the program manager. And the letter is really just to inform the participant of the time commitment that will be needed for the program. The letter also provides a summary of the Housing Specialist Certification Training Program. And after participants have submitted the letter of agreement, I will send them an email with the registration link to register for the training. This helps to determine if the housing specialist is confirming that they'll be able to participate in the training. So once they've registered, it lets me know. Sometimes in the past, there have been participants who don't register. So for me, I take it that they will not be able to participate. So sometimes I will send out reminder emails to staff just to ensure that they got the link and that they will be participating. So after providers have registered for the program, they will receive an email with information on phase 1, which is the online pre-course. This email will contain the link to access the course as well as the password to access the modules. Participants are required, again, to achieve an 80% or above to be invited in the in-person training. And again, if participants do not achieve a satisfactory passing score, they will not be invited to participate in the in-person training. So I make sure to inform participants to keep record of their scores. The platform that we use doesn't send an email to staff letting them know this is what you scored. We haven't been able to figure out how to do that with the platform that we use. So I just remind participants to ensure to just keep record. And I provide a table as well in the email that I send out with a table where they can record what they score for each module. The in-person training is also composed of a pre and post test, as I mentioned, and participants are required to achieve an 80% or above to receive their certification. And again, if participants do not achieve a passing score, they will be asked to participate in the in-person training again. So they will not have to do phase 1, they would just have to do phase 2. And then, as you can see, after the housing specialist certificate box, you will see 2 additional boxes, which is the supplemental workshop and webinar. So housing specialists who have completed the housing specialist certification training are required to complete a supplemental workshop or webinar to keep their certification valid. And today I'll be sharing some of the results that we've been able to collect from the housing training, the supplemental workshops, and the webinars. And again, if you have any questions, please put them in the chat box and I will answer them as we go along or towards the end of the webinar. So I do want to open up by saying that I am very pleased with the data that I'll be sharing with you all today, and from all 3 aspects, the certification training, the supplemental workshops, and the webinars. So first, I'll start off by giving you information from the housing specialist certification training. We have already conducted 9 online courses and 9 face-to-face trainings. In total, 90 housing specialists have participated in the training. This number reflects staff who have left the agency as well, or maybe transitioned to another department. But in total, there have been 90 housing specialists. So we've captured quite a few people, and with the data that we have, I'm sure that you will all be pleased as well. So we use various tools to collect information, and I'd like to share that information with you all. So some of the tools that we use, of course, are the online pre-course assessments. We use the in-person training pre and post tests, which again, participants are required to achieve an 80% or above to pass. The assessments and the pre and post tests gauge participants' knowledge of the material, and it helps us measure if there was an increase in knowledge after participants have received all the information. We also use a tool to measure participant satisfaction with the training, and we use the training evaluation form for that. In addition, at the end of each in-person training day, we ask another member of the SEBA team, or we ask another member of the SEBA team to conduct a Delta Plus activity. This gives participants the opportunity to share what they've enjoyed from the training and what they feel would help improve it, as well as provide some feedback of the facilitators. So during this activity, typically the facilitators of the training are asked to step out of the room, so that way participants are comfortable, or not necessarily comfortable, but more open to share their experiences and thoughts. And then a follow-up survey is conducted where we contact housing specialists who have completed the training to determine if the skills and competencies from the training are being utilized. So for that, I'll talk a little bit more about it, but we also conducted phone calls for that to get a more in-depth idea. So these are the results that I'm sharing with you, which are for all 9 trainings. So starting from the pilots all the way to the last training that we had in January. Again, I'm very pleased with the information that I'm sharing with you all. These are the results from the training evaluation tool, or the training evaluation form, which is distributed at the end of the 3rd day of the training. As you can see, overall 96.4% of participants felt that the training was good or very good. We can also see that the tool measures how participants feel about the content, facilitation, and exercises/activities. 96.7% of participants felt that the content was either good or very good. Over 95% of participants felt the facilitation, exercises, and activities were either good or very good. And again, this reflects all 90 housing specialists that have received this training. These are some comments that participants have included in the training evaluation form. So for those of you who have participated in any of our trainings, you are familiar with this form. It has the likes and wishes section, as well as an additional comment section. And the comments speak for themselves. I won't read through the comments, but I'll leave it on for a few more seconds for you to be able to read what participants shared. All right. So this is the foundation of the work that we do. Dr. Miguel Chion, who was the director of the SIBA program, created this formula by adapting it from a rushing evaluator, and it is capacity equals competency times practice. So competency is translating learning into action, and this is done during the role play activities conducted in the 3-day in-person training. Practice is practicing the action over time. Research shows that it takes about 3 to 6 weeks to forget what you've learned if it's not put into practice. And so in order to measure if participants are practicing the skills and information that they learned from the training, we have conducted the follow-ups with staff who have already received their certification. So the 3-month follow-ups measures the housing specialist competence in implementing the steps of the housing services model and their confidence using the skills learned from the training. The results show that 80% of staff feel confident implementing the steps of the housing services model, and 85% are confident using the skills from the training. So what I did to gather this information was I developed a survey and I sent an email out to staff. However, there wasn't much feedback, so we decided to call a few participants who did attend the training and receive certification to get additional feedback. So this data reflects those who were able to complete the online survey and the phone call. The same questions were asked for both. We also measured the level of support housing specialists received from their teams, their agency, and program partners to implement the housing services model. And we can see that over 77% of staff feel support from their team and their organizations, and a little over 71% feel support from their program partners. We've really encouraged program managers and coordinators to participate in the housing specialist certification training to support their team in implementing the housing services model. In the trainings that we have conducted, housing specialists have shared that there are limited amount of resources available that can cater to some of the needs of the clients that they work with. And we also encourage housing specialists to take the opportunity to network during the housing specialist certification training, and to also network during the monthly CHIRP meetings to identify resources and providers that can assist with meeting the needs of their clients. Right, so another big issue is even finding housing, right? And that's because we're aware that LA has a housing crisis. And so what I tell housing specialists is there's only so much they can do in terms of that. But if they are able to meet the needs of their clients with identifying resources that are available, then that can be really helpful to kind of get them in the right steps to be able to obtain and maintain housing, or while they're looking for housing. And I know that sometimes resources can be difficult to find, but that's where we really encourage staff, network, share each other's emails, during the training, during the workshops that we have, because a lot of your staff are very knowledgeable about resources in the area, in the community. And we've been fortunate that your staff have shared that information with other housing specialists during the training. I had one housing specialist ask for another housing specialist contact information because he had a wealth of information. And I'm glad that he was able to share that info with everyone during the workshop. So I wanted to share with you all some of the comments we've received from the follow-ups that highlight an increase in capacity as the housing specialists have practiced the skills that they learned since participating in the training. And I'll leave this on for a few seconds so that you have some time to read the comments. All right. So now I'm going to share with you all some of the data that we've been able to gather for the supplemental workshops and webinars. Based on the professional development needs that we've been able to gather from previous trainings, we found that a series of workshops and webinars would really help support housing specialists, especially in their professional development. In addition, HCIDLA required that certified housing specialists complete either one supplemental workshop or one webinar to keep their certification valid. And I am glad to see that some of your staff have participated in multiple, and that's great because this is something that they requested, that they said they needed. And so I'm glad to see that you have all supported your staff in growing in their professional development needs. So the evaluation tools that were used for the supplemental workshops and webinars included the workshop evaluation form and the online satisfaction survey. The workshop evaluation form was used during the in-person supplemental workshops, and the online satisfaction surveys were sent to staff who participated in the webinars via email. So first, I'd like to share the data that we gathered for the supplemental workshops. We had 4 in-person workshops, which included the core competencies, self-care and burnout, managing challenging client behaviors, and the mental health and substance use screener and brief intervention. I wanted to share with you all the number of participants that we had for each workshop. Due to the amount of HOPWA housing specialists that we have in LA County, I work closely with program managers to manage the number of participants for each workshop. Managers are emailed and asked to send the names of 2 housing specialists who will be participating in the workshop. After I've received the names of the housing specialists, I contact the housing specialist directly and coordinate the registration process. As you can see, the number of participants decreased from workshop to workshop, and this could have been due to a series of reasons. It could be that housing specialists have a high caseload that they need to work with. Sometimes it's even the distance from the agency to the workshop site. So this is based on what housing specialists have shared with me in the past or during these workshops. And so there could be other reasons as well that we see that decrease. But again, I thank you all for being able to work with your housing specialists and send them to these workshops to get the information. I do want to mention, if you notice the comment at the bottom for the mental health and substance use screener and brief intervention, we did start off with 5 participants, but we ended with 3 participants. So I just wanted to share that information with you as well. This is the data that we gathered from the workshop evaluation form, and the data being shared with you all is the housing specialist impressions of the workshop overall. So we can see that overall, 81% of participants felt that the core competencies workshop and the managing challenging client behaviors was either good or very good. And 100% of participants felt that the self-care and mental health and substance use screener and brief intervention workshops were very good. The data that I'm sharing you for the mental health and substance use screener workshop only reflects the 3 participants that completed the workshop on the 2nd day. So that workshop was a 2-day workshop. APLA Shared Action is thankful that we have the opportunity to collaborate with Inner City Law Center and the CCA to develop and deliver the webinars, the tenant legal rights webinar and the income eligibility webinars. Originally, these webinars were only going to be available to certified staff. However, a few agencies had new staff join their team, and so we felt that it would be important that all staff receive the information that was going to be shared. And the number of participants in this table reflect certified and non-certified staff that participated in the webinars. And we can see that we had a really good turnout for both. And here, I mean, we can see like 37 participants. And again, some participants have shared, you know, it would be easier if it was a webinar than going in person because of caseload or because of distance or other reasons that they may have. So unlike the workshop evaluation forms, satisfaction surveys are not always completed by 100% of staff who participated in the webinars. However, the results that we were able to gather show really positive results. As we can see, 88.2% of participants felt that the overall webinar for tenant legal rights was good or very good, and 86% of participants felt that the overall webinar for income eligibility was good or very good. As I mentioned, I'm very happy to share this data with you all. And I honestly would not have been able to do any of this without your help. So I want to thank you all for working with me and keeping an open communication via email about staff who will be participating, staff who will not be able to go. Some of you have let me know, hey, like so-and-so was not able to participate in the webinar because A, B, and C. So I really appreciate the communication that you've all had with me during this time working with these supplemental workshops and webinars. So now that I've gotten the opportunity to look at some data or to share that data with you all, let's shift gears and talk about what APLA Health Shared Action has planned for the 3-month extension. So we've planned a few activities for the contract year to continue to support the growth of housing specialists. For one, as I mentioned earlier, there will be a housing specialist certification training. So we will be doing one for this contract year or for the extension. And this is for housing specialists who have not been able to complete previous trainings that weren't able to go, or for new housing specialists. As I mentioned, I've already begun sending out letters of agreement. Some of your staff has already sent me other letter of agreement, and I've started sending out the registration link. And as we can see, phase 1 is coming up really soon. That's the online course that's scheduled from May 6th through May 10th. I close the access to the website at 5 p.m. on that Friday of that week. So just a heads up. And I also don't give extensions for those who are unable to complete it, because they do have 1 week to do it. So that's just a heads up for you to share that information with your staff so that they are able to coordinate their time seeing clients and being able to complete the online course. Phase 2 in-person training is scheduled May 15th through the 17th. That training is scheduled from 8 a.m. to 5 p.m. and staff are given 1 hour lunch. So that's just another heads up as well in terms of time and the time that they'll be out of the office. So it's 3 complete days. We have added an additional webinar, which will be covering employment and housing. Many clients accessing HOPWA earn their income through SSI or GR or SSCI, and sometimes they may feel unmotivated to seek employment because they fear that they'll lose their benefits. So this webinar will go over HUD's Getting to Work initiative, as well as provide a short Benefits 101. The Benefits 101 will cover what happens to a client's benefits once employed. There will be information on the Ticket to Work program as well. So that could be useful information for housing specialists that they can share with staff. And then again, remembering the roles and responsibilities. Sometimes housing specialists will just have to refer their clients to a benefits specialist to be able to provide more in-depth information, because that would be their role. I have emailed program managers with the names of staff who have completed the required supplemental workshop or webinar, and staff who have not yet been able to do that. I do want to mention that this webinar will be open for all housing specialists, but it will also count towards keeping the housing specialist certification valid. So for those staff who haven't yet done the webinar, I encourage you to let them know that this webinar will be available, that it will count for them to keep their certification valid. I have already sent out a newsletter specifically for housing specialists, informing them of the 3-month extension activities that we have planned. And then I've sent all of you program managers and coordinators a newsletter as well with this information. This webinar is scheduled to take place June 13th using the Zoom platform. I have not yet begun registration for this webinar, but I will be sending an email to everyone once it does become available. And again, it's open for all housing specialists, so those who are certified, those who are not. And I know some of you also like to share some of the information to other people in your team. So if you feel that they could benefit from this workshop, if they provide any type of housing information, then they can join as well. So all of you may already have my contact information, but here it is again. This actually concludes the webinar. Does anyone have any questions in terms of the activities, the extension that we have planned? Giving people a minute if they're typing. All right, seems like no one has any questions. You can always reach me via email or my office number if you have any questions. You know, I'm always available. Again, I appreciate all of you for working with me, and it's such smooth communication with you all. So I really do appreciate that, and really sending your staff for these additional in-person workshops. I know that they have so much on their plate, and I know that the intakes take such a long time that we really appreciate the time that they've given us, the time that you have given us, and me specifically, because I speak to all of you. So again, if you have any questions, you can reach me. This concludes today's webinar, and thank you all for joining. Thank you, Juan, Jasmine, and Herbert. I appreciate it. All right.